Hi, my name is Wayne Cooper, and today I'm going to be giving you a short 10-minute presentation or thereabouts on lower limb stress fractures. Before we get started, I would like to give you a handout to everybody. Don't normally do this at the beginning, but this will become apparent why I'm giving you this in preparation for the next slide, which is a little activity. So I'm going to hand these out to everybody. There we go, and if we move to the next slide now. So a little activity, a bit of refreshment for anatomy. So what I'd like you to do here, ignore this picture here, but number one is the black arrow here. So I'd like you to annotate where that stress fracture is located. Number two is a blue circle. Number three, same picture as the red arrow. Indicate the bone, and you can also say medial or lateral or proximal or distal. And number four, which is in this area here, of this bone here. So if you could just jot these down, 1, 2, 3, and 4. I'll give you a few seconds to do that. And I'm going to give you 2 points for each one, depending on how you do. So a total of eight points. And we will mark these at the end. Just a bit of a refresher for anatomy. So hopefully we should have them, and we'll, like I said, we'll come back to them at the end of the presentation. So the contents of the presentation then, we're going to be looking at an introduction on why I've picked stress fractures, which type of athletes it affects. We're going to look at diagnosis, really important factor, and then from that we're going to move on naturally to treatment and management of that diagnosis. And then we'll summarise, and then I'll give you a chance to ask any questions, and on that questions slide there'll also be the references I've referred to, which are the references I utilised for the research paper, and I've added a few references as well just to enhance this presentation today. So why did I pick stress fractures then? Well, in 1995 to 97, and I've been in the military probably about 8-9 years at this point, I was a physical training instructor at the Army Training Regiment in Purbright in the United Kingdom, taking recruits on PT, physical training, and we did see a lot of recruits who were having to have a lapse in training due to lower limb stress fractures. So that sparked an interest, and then in 2002 I was now an exercise rehab instructor, trained in exercise rehabilitation, mobility, strengthening and progressive build-up of fitness and stuff like that. In 2002 I was seeing a lot of patients who had stress fractures in Kosovo, which was a 6-month tour. A lot of times soldiers can be busy on tour, but they can also have a lot of time to themselves, and where they've got no family they normally train a lot. Now that can be a good thing or a bad thing, overtraining, and we'll come to that later. Now approximately 90% of all stress fractures as well are related to the lower limbs. So again, that sparked an interest for me to do it. And in the military, the majority of injuries as an exercise rehab instructor I was seeing were lower limbs. And a lot of these were stress fractures as well. So what is a stress fracture? Well, a stress fracture is like a hairline fracture, a small crack in a bone, or it can be bruising and swelling of a bone as well. Now the people who could be prone to this are people who are involved in impact activities like runners, and also sports people who are involved in maybe soccer or basketball, jumping and landing as well. So impact through a joint and through the bones. Now you might ask why. There's a few number of reasons. It could be various factors. It could be a change in surface. So it could be somebody who runs on their treadmill, for example, in the winter, and then as spring and summer come, they're going to move then and they're going to start running on the pavement. So there's going to be more impact going through the bones to cause a stress fracture. It could also be someone who started a new activity and done too much too soon, or an increase in exercise activity. So it could be somebody training for example a marathon. So moving on to diagnosis then. Now this is key to the management and treatment of the injury, because if we can have a correct diagnosis, then hopefully you would like to think that the management and the treatment plan are going to be correct and hence speed up the process. make it as quick as possible, which is really important if we're talking about an elite athlete or sports person, to get them back on the field as quick as possible. A thorough patient examination, now seeing a specialist, someone who's qualified to diagnose this injury and look at the symptoms, and then moving on to a history, diagnosing a history. Have you suffered from stress fractures in the past? Was there a sudden impact to a lower limb bone? Anything the doctor can gather to make his diagnosis more accurate. The reason I put down here magnetic resonance imaging, MRI, is because MRI is a gold standard in regards to imaging. And the reason it's a gold standard is because it's the specificity of the machine in taking pictures of the structures that it needs to determine whether it's a stress fracture or not. You can use X-ray and you can use bone scans, but MRI is the gold standard. Okay, so moving on to treatment and management. I'm going to use my notes for this one. There's quite a lot to talk about here. So first of all, internal and external factors. Now, really important that these issues need to be dealt with and rectified to avoid future injuries. Now, some of these are poor equipment. So your runners, they could be old, you need to buy a new set, they could not fit correctly, or you could have flat feet or high arches. So maybe you need a certain specific type of running shoe. It could also be improper technique or altered gait of mechanics on how your feet absorb impact. Could be a change in surface, as we said earlier, going from maybe running on a treadmill to the pavement. And it could also be bone insufficiency, so lack of vitamin D. Now we're talking about diet as well. Females as well, I'm just going to touch on this for a second. Females are more prone to this, and this is called female athlete triad. This is when a girl or a young lady goes to extremes in dieting or exercising or both, and then she could suffer from 3 interrelated illnesses which may develop, which are eating disorders, menstrual dysfunction, and premature osteoporosis. Now, if this happens, then the athlete's bone mass decreases, so the mass of the bone decreases, which in turn increases the chances of the athlete getting a stress fracture. So moving on now to conservative treatment then, we've got RICE, which is rest, ice, compression and elevation, and anti-inflammatories as well. Now this part is normally typically between 6 and 8 weeks long, can be a bit shorter or a bit longer depending on how soon you've been diagnosed and how far on that stress fracture is, but typically between 6 and 8 weeks. And this is where you're going to need to modify your exercise. So if you're running, you're going to need to tone that down a little bit, or go to cycling, or even non-weight bearing, so swimming, stuff like that. Really difficult for people who are really dedicated in running because they don't want to, and this can just make the injury take longer to heal. Doctors may also prescribe a protective boot just to relieve the stress, or they may also provide a cast. With metatarsal stress fractures, sometimes they take a little bit longer, so the doctor could prescribe a cast just to help with the healing of that stress fracture. Now here I've noted injury site specific protocols. Now this was on one of the research papers. I'm not going to elaborate on this too much because this would be another 20 or 30 minute presentation on itself. But this went into specific protocols for specific injuries and different sites. But what I did do is I generalized the 3 papers and I took the general information for the presentation we're doing today. So moving on to gradual introduction to activity. Again, once we've gone past the conservative treatment, we've modified our exercise, now we can start introducing the exercise that maybe caused a stress fracture. The sport, the soccer, the basketball, but progressively and slowly, not too quickly, or you're just going to get that stress fracture is going to come back again. So just to summarize then, Diagnosis, really important. If we've got a great and really good diagnosis, it's just going to mean the treatment and the management plan is going to be good. MRI is the gold standard for imaging. Other scans, we could use a bone scan or an X-ray. Underlying issues need to be identified where possible and rectified, and we covered a few of those earlier. And conservative treatment, RICE, really important, and modifying the exercises as well while you're doing the conservative treatment. We won't touch on that site-specific protocols. Moving on then, gradually increase back into activity. So progressively and slowly reintroducing the activity that probably caused the initial stress fracture, whether that's running or sport related. Now the reason I put ongoing research here, because the papers I used for my article did specify that ongoing research is key to the diagnosis and management of treatment and continued management and treatment for stress fractures in the future. So that's the reason I put that down there. This next slide is just one I've added. So this one I've added because I know a lot of you are really into sports. A lot of you play hockey or you're into martial arts. So do you know prevention is key? It's 10 times better than management and treatment. With prevention, you don't need management and treatment. So I'll just touch on these briefly. Healthy diet, so rich in calcium and vitamin D. It's going to make the bone stronger. Use proper equipment, runners that fit appropriately. Start new activity slowly, speaks for itself. Cross train. If your activity is running, then maybe also if you do other activities, introduce cycling or swimming as well, so a non-impact or a non-weight bearing activity. Add strength training to your workout. It's going to make your muscles stronger and your bones stronger. And if you do feel any symptoms, then stop the activity and seek the advice of your local doctor. So that concludes the presentation. If there's any questions, feel free to ask them now. Also, these are all the references I've used, and we're going to finish off with the answers. So number 1 was the mid shaft of the second metatarsal on the right foot. Number 2 was the distal end of the left fibula. Number 3, the proximal end of the left tibia, medial aspect. And number 4, the superior aspect of the neck of the left femur. Now these are the pictures here, number 1, 2, 3 and 4. So 2 points for each one, a total of 8. And that concludes the presentation.